are increasing. The virus is getting stronger, not weaker. Before I update the numbers, let me just set a little bit of context. There really are three things that are happening that are working together to create the surge that we're seeing. Our vaccination rates have fallen off. They're not proceeding nearly as fast as we would like. Mask usage has really gone way down, including less concern about social distancing. And we've had the introduction into the region of the Delta variant, which is estimated to be about 60% more contagious or more transmissible than the Alpha variant that we experienced during the winter. So those three things together are contributing to a new surge, a heavy surge, one that, unless we can exercise corrective action, is likely to equal what we experienced in the winter or perhaps exceed it. And we'll come to that later and talk about why I feel that way. I do want to say at the outset that this is not simply a rural problem or a problem with underserved neighborhoods or a problem with any particular group. It's broad. It's true we are receiving cases that have been transferred from other parts of Missouri, from hard-hit areas that are running out of resources, but the majority of patients who are being admitted to St. Louis hospitals right now are from St. Louis. They're from this area and they are contributing to spread in this area. Cases here are rising exponentially in some new populations. The spread among younger age groups is much higher than it was before. And in a disconcerting way, we're now seeing the return of this virus in a very active way to underserved areas of the city. Infection rates in African Americans are 4 to 5 times what they are among other citizens in St. Louis County, as an example. So this increase in infection rates has also contributed to an upturn in hospital admissions. If you've been looking at our numbers, you've seen those facts play out in real time. I'll update you on the numbers as they stand today. And once again, we saw more people in hospital today than we had before. I do want to say that almost everyone who comes into the hospital for COVID is unvaccinated. It's not that we don't have some breakthrough cases, and those tend to make the rounds when a patient who has had full vaccination becomes ill enough to be hospitalized. But the vast majority of breakthrough cases are much milder than the cases in unvaccinated individuals. And in the hospital, the vast majority of patients are unvaccinated, particularly among ICU cases and those who are ventilated. There is also a question about whether the Delta variant, which we're dealing with now, is more virulent, causes more severe disease. That's difficult to say for sure, but a high proportion of individuals coming into the hospital are winding up in the ICU and ventilated, and it may well be the case. So in summary, the virus is coming back, and it's been stronger than ever before. Now, while I did mention that the Delta variant is really the driver at this point, that's not the most important fact. At any given time, we may be dealing with a new variant. And the important point is that this virus mutates. The new mutants that survive and become predominant are almost by definition ones that are more transmissible, more easily spread from one person to another. The only way we're going to get past that cycle is to get sufficient levels of immunity in the population, and the only way that is likely to happen is through strong vaccination efforts. Again, efforts that have stalled to date. So we'll talk more about vaccination in a minute, and we'll look at some of the rates. But I do want to say, even if all the unvaccinated citizens in our communities decided tomorrow to get vaccinated, that would still put us some weeks away from flattening the curve that we're experiencing now. First of all, there's a large number of people unvaccinated, and it takes time to do that. Even once they are vaccinated, we know that the most common regimen is a 2-dose regimen that takes 3 to 4 weeks to give both doses. And on the heels of that, it takes another couple of weeks before we'll reach the full immunity from the vaccinations. So we're not going to staunch this rise in cases quickly through vaccination programs. But vaccinations do remain the essential ingredient for whipping the COVID-19 virus once and for all. So what do we do in the meantime? I think that is, we need a return to a more vigorous use of masks in the community. So whenever people are out with others, particularly if you don't know their vaccination status, it's prudent to wear masks. If you've been vaccinated, it's still important to wear a mask because we do see breakthrough infections. You can acquire COVID and you can pass it on to other people. So both for your protection and for the protection of those around you, wearing a mask, even if you've been vaccinated, is important. If you haven't been vaccinated, not only are those things in play, but you may also save your own life by wearing a mask. So the best you can do for right now is get vaccinated and wear your mask. And with that, we'll move on and look at some of the numbers. So this first graph shows the epidemic curve for the St. Louis metropolitan area. It starts some 16 months ago when we saw our first cases in March of 2020. And you can see the rise in cases both in the midsummer, roughly where we are now, and later in the fall when we had the huge spike that carried us through the November and December holiday season, as well as the rapid decline afterwards, which was largely the impact of measures to reduce transmission through masking and social controls. We also know that increasingly as we got into the late winter and spring, the impact of vaccination started to be felt, and that's really accountable for that last dip that we saw in April and May to get to the nadir in mid-June. But now we're on the upswing again. We're seeing numbers that are more than twice what we saw at our nadir, and that's the problem that we're in because we don't see a decrease in that coming anytime soon. This is our report of weekly changes in numbers week over week. 44.2% is in the range of what we saw in our previous high spikes. And again, we don't see coming down on the end of this. So for right now, we are in the red zone in terms of the progress of this pandemic. For those of you who like to follow the reproduction number, again, something made famous by this pandemic, we're currently at 1.29. Any number that's greater than 1 means that the epidemic is spreading. There are more cases today than there were yesterday. When that number gets below 1, we know that the epidemic is contracting. Right now, we are not on a pathway that, as far as we can see, to getting to lower numbers. Currently, we have 255 patients in hospital. Our ICU census is almost 90, 50 of whom are on ventilators. These numbers are ones we haven't seen since late winter and early spring and are not showing any sign of diminishing. This is a graphic showing the new hospital admissions, again showing the same pattern roughly that we've seen for the epidemic overall, but instead looking at hospital admissions. The worrisome thing is the tick up on the right, which is as steep as any slope we've seen to date and actually accelerating. And this is the number of people who are currently hospitalized. Again, you see the 255 number on the right for current in hospital. And our 7-day moving average, which is 231, is actually just lagging behind. Each day for the past week or two, that number has gotten higher and higher. The number of deaths, thankfully, has not started to rise. We do know that death is a lagging indicator. Unfortunately, deaths from COVID are often long and agonizing. And we will be watching this number, which I expect to rise. Hopefully, because of the vaccination efforts that have occurred thus far, we won't see as big an increase in COVID-related deaths, but time will tell about that. One of the important things about this wave, which I've already mentioned, is the shift in the age demographic. This graphic shows the age distribution across 4 age strata beginning in January. And it's very easy to see that the lightest color, the light yellow, which represents individuals who are under the age of 45, has increased over time to where it's almost a third of all cases that are being admitted to hospitals. On the other end of it, it's great to see that those who are over 75 have had an increasingly decreased likelihood of being admitted to the hospital, such in the most recent week, this is about 10%, and that's a really good finding since those elderly individuals are at highest risk. Trying to decide what's ahead is always a challenge, and we have used models throughout this pandemic to anticipate where we need to go. It's actually served our region well and enabled us to take corrective actions early on. This is a look at the prediction for ICU census. Once again, you can see the sharp tick up in ICU cases at the far right, and you can also see the blue bands, which give an estimate. The midline is the best estimate, and the outer lines are sort of the range of estimates. Unfortunately, all practical predictions about the future say we will continue to see increases in the number of cases. And it's similar for inpatients. The slope up doesn't appear quite as steep, but if you look at the numbers on the left axis, you'll see that this chart goes up to 1,500 cases, which is about 50% more than we experienced in our previous surge, and that is something we are trying to desperately avoid. One question has been, how do we look compared to Southwest Missouri? And so we've done some additional analysis to compare our curves to what they've experienced there. In the graph on the left, you can see absolute numbers of cases over time in the St. Louis metropolitan area in orange and in Southwest Missouri in blue. What we've done on the right is we've corrected that for population size. We've adjusted it, so it's the number of cases per 100,000 population. And there the curves, while they're a little bit ragged, are really fairly similar across Southwest Missouri and St. Louis metropolitan area until the last few weeks. That sharp upturn in Southwest Missouri, which we've been reading about every day in the paper, is the evidence of the spread of Delta variant as it's moved its way through that population. Southwest Missouri continues to be in an extreme state. We hear calls daily about difficulties in finding enough room for patients, and indeed, patients are being transferred from the Springfield and Joplin area to other parts of the surrounding states, including St. Louis, for care because they're simply out of spots to put them. The orange graph at the bottom shows that we are just beginning to get on a similar rising curve. And at this point, we don't see any evidence that we are likely to see a different trajectory unless we take some aggressive actions. That leads us to what can we do? We have two weapons: vaccination and masking. And first, to talk about vaccination. We really moved fairly quickly at the beginning, and over 1 million first doses have been administered to citizens in the Missouri Region C. We'll see similar numbers for the Illinois region in just a moment. And nearly 950,000 have completed a 2-dose series and would be what we would call fully immunized, although we know that some of those individuals can have breakthrough infections. That gives us approximately 51.2% of citizens of 18 and older in Region C who've been vaccinated. That's great, but it's not enough. If you translate that into the total population number, that puts us somewhere in the low 40% range of the region, and we really need to push north of 70% to effectively halt transmission of this virus once and for all. This graphic you won't be able to read probably on your screen, but you can certainly access the slide after this presentation, and shows the counties that comprise the St. Louis metropolitan statistical area. The Missouri counties are on top, the Illinois counties are on bottom. The darker the county on the map, the higher the percentage of citizens who've been fully immunized. And you can see from this map that St. Louis and St. Charles County on the Missouri side are both in the 44% range, and Monroe County on the east side is up almost to 50%, and those are the areas with the greatest vaccination penetration. But it's important to know that this is really a peanut butter look at what's happening, and it's actually the communities underneath where vaccination rates are very variable. So in St. Louis County, for example, the vaccination rates are in the highest places are in the 80–90% range. In the lowest neighborhoods, we're down in ranges that are very similar to what happened in some of the counties of Southwest Missouri. And for that reason, those areas can expect to see that kind of steep upturn in cases that was experienced by our fellow citizens outstate. On the other preventive measure that is readily available to all citizens, regardless of vaccination status, masking has declined substantially. This is information collected from internet survey data. Back in March, when we saw very strong control of COVID, we were in the 80+% range, and by the most recent numbers, we were down below 30%. We really need to see that number rise, and that can be accomplished by having many people wear their masks all the time, or all people wear their masks some of the time. Whatever we can do to get people to wear masks as much as possible will be a good step towards halting spread while we continue to work on vaccination rates. So the bottom line is, to this date, we have taken care of a lot of patients in this region with COVID. We've discharged alive over 23,000 patients, but we've also seen 2,200 patients expire while under our care. That is probably half of the overall death rate in the region, maybe even only 40%. So if we're going to avoid more deaths and more hospitalizations, we really need to take action. So that concludes my prepared remarks, and I think I can take the questions that have been fielded so far and just try to work through those. So the first question is, am I concerned about what is happening to hospitals in Springfield and whether that will happen here? And I think the answer to that is obviously yes. We're very concerned that we could follow a very similar pattern. It is true that with higher vaccination rates here, we might see somewhat different results, but as I mentioned, particularly in areas of the community where their vaccine usage rates are low, we could see numbers as quickly rising as we did there. Second question, how is the task force hospital systems requirement that staff get COVID-19 vaccine impacting the systems? Are employees quitting over this or fighting the requirements, or is it going smoothly? And how many more people are vaccinated now because of this requirement? Well, as you probably know, or maybe you don't remember, the deadlines for those vaccinations are in August and September, depending on which organization you're talking about. So we haven't passed a point where we've asked people to be vaccinated by. That said, BJC, we had approximately 70% of our workforce had been immunized at the time we decided it was time for us to make it a mandatory vaccine. At this point, we're over 80% of people who have either been vaccinated, have produced documentation of an acceptable exemption, or have at least started the vaccination series. So we're well on our way to completing the workforce. We do know that there are many individuals who are still holding out. Some are waiting for the FDA to approve the vaccine. That is a formality in our view, but we do believe it will come. Others have other opposition to the vaccine, and we're trying to work our way through those reasons and show people that these vaccines are literally among the safest, most effective vaccines ever produced. And really, you should not listen to people who tell you otherwise. The facts are incontrovertible with billions of doses having been administered. We know that these vaccines are very effective and useful. What could this fall and winter look like if the vaccination rate continues to remain stagnant? Well, I think as people move indoors for the winter, we will see the seasonal characteristics of coronavirus probably pile on top of what we're seeing right now. And I think the situation can only be worse if we haven't mastered some of the other things we've talked about. Next question. Today, we hit the highest number of cases since January. Should we expect the hospitalizations in the coming weeks to increase to levels we saw in the winter? And I think we've covered that in several ways, but I think the unfortunate answer is without more vaccination and mask usage, the answer is yes. At what point should vaccinated people be worried about this new spike? Well, the truth is, if you look statistically, anyone who's been fully vaccinated is pretty well protected against this new variant. And most people who do have a breakthrough infection will either have no symptoms or have very mild symptoms. That doesn't mean everyone, and there is some small percent of people who could have serious infections, including some who will wind up in the hospital. Often those individuals have challenges to their immune system from either underlying medical conditions or medications that they're taking for an inflammatory disorder. So it's rare for someone who is in otherwise good health, who's fully vaccinated, to have a serious problem. So I think those who've been vaccinated should feel confident in that regard. Next question. Describe the average hospitalized COVID patient now and how does this compare to the average patient in previous spikes? So again, one of the things that was good about the first round is a large proportion of people at risk because of age or underlying conditions did seek out vaccinations. So they have occupied an increasingly smaller percentage of individuals that are hospitalized. There's great evidence of the effectiveness of the vaccine and a hope for those who want to avoid those potentially severe outcomes. Next question. If you've had COVID and recovered, do you need the vaccine? And I think the very strong answer to that is yes. It is true that some individuals who've suffered from COVID infections will develop strong and long-lasting immunity. The problem is it's not predictable based on the severity of their initial symptoms or who they are. And we do know that vaccination produces reliable, high levels of protection. In those who have already had COVID, it is a very strong booster to that immunity and probably affords them a level of protection that may be even higher than a completed vaccine series. Next question. Do unvaccinated individuals pose a risk to older vaccinated individuals? Once again, the answer is yes. We do know that the vaccines decrease the risk of untoward events in older individuals, but they don't completely eliminate it. And there may be individuals who suffer significant infections, even if vaccinated at older age. Next question. If you didn't get the second shot, is it too late? No, it's not too late. Though the vaccine regimen used in the original trials was 2 doses 3 weeks apart for Pfizer and 2 doses 4 weeks apart for Moderna, getting the second dose at any point will boost your immune response to a substantial level, and you should proceed to do so if you haven't gotten it. Fourth question in this group, how easy is it to get COVID testing? COVID testing is widely available, both through healthcare providers and through health departments. So I think anyone who has a question about whether they may have symptoms should seek out testing immediately. I've noticed some chatter about the recommendation by the health department, some of the health departments, that you should get tested even if you have a mild set of symptoms, say a runny nose and a sore throat, or even just a headache. And the answer is the pattern of symptoms may have shifted with Delta to include these sort of milder onsets of illness. And while they may just be a cold, which none of us would ever seek care for in a normal time, it's very important to know right now whether those mild symptoms represent a COVID infection. Next question. How many hospitalized COVID patients are vaccinated? We don't have precise numbers, but all the studies we've done and looking through case records, it's somewhere between 1 and say 8 or 9% have been vaccinated. So more than 90% in almost any group we look at has not been vaccinated. That is the single biggest problem that we're facing right now. And the final question here is, if someone had COVID but others in their home didn't get it, are they okay, or should they get the vaccine? And again, back to what I said earlier, the overall immune response to a natural infection with COVID is unpredictable. All individuals who've not been vaccinated should get vaccinated, whether they've been ill with COVID or not. So with that, I'll conclude the questions, and thank you very much for tuning in today. We'll be back on the air sometime in the next 10 days.